Okay, it's recording now. All right. What question do you have? You always have excellent questions.
I'll try my best. So I read everything and I use
Yeah.
AI. So I put your articles in AI with a bunch of all my stuff, my information, my labs,
So
whatever.
which AIs do you use?
I use Claude and it's linked with self-decode genetics. So there's a bridge between the two
Oh,
software.
excellent. Yeah. You're using the Claude code, right? The
Yeah.
desktop version.
So it sees my genetics, so it can make a
Yeah.
bunch of links. So and what's been or confusing for me lately in your most recent article, I understand the depletion. I understand starting lower, so I've restarted this week lower at 0.1. But the thing is that now there's so much different aspect that you put out there with methylene blue,
Oh yeah.
with alternating days, with doing 5-2 or every other day. So I had my game plan, and then I saw your article, and I was like, "Oh, wait a minute! Now, what am I supposed to do?"
You
And
know what?
so,
You do what you think is right, but
yeah, I
the
know.
general way is that general way in medicine, as you're a nurse, right?
Mhm.
As you know, it's very very simple. Let's say a high blood pressure patient comes in, right? And then there are many medicines, but usually you start with one, and then you kind of push it right to
Mm.
the level of like optimal, and then beyond the optimal, you can still go higher, but the chances of getting side effects is higher now. Do you know what I mean?
Yeah.
So what do? They add a second agent, and then they push. They do the same thing. So if you think about it that way, it's very easy. But for me, and it doesn't work for everybody because some people are so sensitive to LDN, even at 10 nanograms, they say they can't take it. And like I said, recently I have had people that I have to use 10 nanograms, and they're having even trouble with that. And then of course the next dilution will be 100 picograms.
Mm.
That's pico is 10 to the minus 12, right? And nano is 10 to the minus 9, and micro is 10 to the minus 6. Milli is 10 to the minus 3. So if you think about milligram to picogram, oh my God, there's like eight zeros.
Mhm.
But that's consistent because in the environmental medicine, we're taught that how we respond to environmental toxin response individually because of genetics differ by billion times, and billion has 9 zeros, isn't it?
Mhm.
Yeah. So I think it's normal. So I would say that do your way, but go gentle, and then push it until you feel like your optimal dose. And some people 1.5 milligram is optimal dose. Some, like I had a kid that had myasthenia gravis, and I think we were at 5 microgram, but the kid the parents were scared, so they were going very, very slowly with 1 microgram, 2 microgram, 3 microgram, 4 microgram, 5 microgram. With children, I always say that parents are right. I'm just a guide. So they went to 5 microgram and say, Dr. Kim, it's not cured, but she can open her eyes, and she is doing much better. She's growing again, and we feel comfortable. We don't want to. This allows us to take a little bit of the Western medicine, but we don't want to use the naltrexone too heavily dependent either. So I said, okay, then let's start the second agent, which was fish oil. So we used and then we dosed it to the weight of the kid, and we did pretty well, I thought.
Hmm. Dr. Kim, do you see MCAS doesn't
Oh my
have
God,
who don't
LCAS.
have ENT, resp, or dermatology, but neurocognitive? So it's not like a full blown MCAS, but some part of it. And how do you go about sort of grayish presentation, not clear cut with the whole thing?
So those are, I think, really again. I think you know my game because you're a professional. You read enough of what I say. Is I always say LDN is my cornerstone.
Mm-hmm.
And LDN is cornerstone because LDN um, normalizes immune system. Now, in the process, the immune system can wobble a little bit, and some people the wobble is very uncomfortable. And I've seen yeast infections happen. Today, I think some recently someone said that they had great deal of difficulty with they feel like their autoimmune disease is getting worse, better. So, the person was trying to get me to agree that LDN makes autoimmune diseases go in cycle, and I just couldn't agree with it. At the end, that's what she wants me to say. So finally, I had to delete her post because it's not based on science. But it is true. In a few people, they don't tolerate LDN. I just had that visit today with one of my patients, and she just cannot tolerate LDN, and she's too afraid to do 10 micrograms or even 100 picograms, which I understand. That is the whole reason why I have that. And I have a feeling that even that 1 microgram may have to be down adjusted. And the reason is the MCAS. And MCAS to me is not a diagnosis. It is if you think about it this way, it's a node. It is a very important common pathway to multiple medication. So when your immune system is sick, MCAS is a symptom, and you can enter MCAS from Lyme disease. You can enter it from post-viral illnesses like long COVID. You can enter it from autoimmune conditions. You can enter it from mold. So if you think about it that way, then MCAS is not just MCAS, but it is a sign and symptom of sick immune system or deranged immune system. Mm-hmm. And so, and then LDN tends to normalize immune system. But and I think what I'm realizing is that there's, of course, more than just LDN microglia for modulating immune system. So another tool that I do use is called ketotifen. And ketotifen is really wonderful because it is a H1 blocker, and it basically normalizes the mast cell function. So if you think about it as brothers and sisters, LDN is a brother or sister of two ketotifen, a sibling to ketotifen, and one takes care of microglia to return normal. The other one uses the mast cell to get it normal. Now you got two big bad wolves that can create problems now. Taming. And then methylene blue, I think the exact mechanism is hard to know, but what I see is that usually people who do really well with methylene blue push it towards pro-oxidant dose, not mitochondrial dose, not serotonin dose, beyond that. And then they stay on it for a little bit, and then they say their MCAS is greatly improved, or their chronic fatigue is greatly improved. So, and if you really think about it, at that dose, we're talking about antimicrobial. But it makes sense because one of the ways you can enter MCAS is hidden infections, like Lyme can give you MCAS, but post-viral chronic viral activation can give you MCAS. So I think that if you think about it, that methylene blue doesn't discriminate like antibiotic. It pretty much kills anything that doesn't belong in your body, and that is the strength of methylene blue. It's a pro-oxidant that, like IV vitamin C, and just like IV vitamin C, you have to really, if you're going to go high doses, yes, you have to do G6PD testing.
Yeah, I just did the G6PD. My concern with ketotifen is the side effect profile is like grogginess and tiredness during the day. So now it's gonna confound a bit. It's with fibromyalgia or chronic fatigue syndrome. Now you're adding ketotifen at bedtime, but the next day you're groggy and you're tired. So
well, then I tell patients if the bedtime is not good, you take it at dinner time.
Yeah. I have it. I haven't started it. I'll start with LDN, one dragon at a time. And thank you for your time. I want to have the others ask questions.
That makes perfect sense in your nursing background, right?
Mm-hmm.
Yeah.
But I did take exogenous ketones. They are amazing. They give me.
Then you know what? It works for you. It's continue doing it because I tried it and I didn't think it. It was great. What when you say amazing, what did you get benefit? Is it energy?
Pain. After 3 days, pain diminishing by 75%. Mental
Which one?
clarity.
Which one are you taking?
It's Prove It, the one that they did with NASA. So it's in the States, but it's available in Canada. So PRUVIT, and they have this thing called K1, and it works in 45 minutes. The window it works, it's like between 4 and 6 hours. Gives you great energy, focus, mental clarity. Takes care of brain
It's
fog.
a drink, right? It says like
Yeah.
heart.
Yeah, you put it
Oh
in
my
a.
god, it's so expensive.
Yeah, it is expensive, but I take half a pouch, so that's about $4 US, half a pouch per day. Can
Oh my
take,
god, it's so
but
expensive.
but then if you've been struggling with those symptoms for years or months, and it gives you a
Then
boost,
listen, then it's it's not that expensive. But oh my god. So the question that I have is, why does it have to be that way?
because
Taurine, it's got the beta hydroxybutyrate. So
so the the thing
inner
with
bark
that,
of no, just one. It's very interesting because they have inner bark of Oncardia tomentosa. That's very interesting. I mean, taurine, leucine, that does nothing, and they have this thing called hydroxybutyrate. You know what? You know what? Because I know, it's not cheap to be sick. Do you agree?
it's super expensive for chronic illness. It's a rich man disease.
Yeah, but you know what? We're all being hit with it. I want you to do me a favor, and can I share screen?
Sure.
Because this is the same. Any of these things is the same. What do you call? You see, beta hydroxy, beta methylbutyrate. It's the same, right? And then I want you to consider getting something that's cheaper
Mm-hmm.
and see if it works. If that
Yeah.
makes sense. Like
Well,
NutriCost is not a bad brand. They're not the best brand, but they're not the worst
mhm.
brand. And it's actually we know about these brands. Same thing
Mhm.
here. And then this one is capsule, so you can avoid.
Yeah, thank you.
Yeah.
Trying to save me money, I appreciate. And the
No,
thing
the thing
is,
is science, right? Science says it's what's the active ingredient. It's not going to
yeah,
be
yeah, yeah,
tolerant.
sure,
It's not
sure,
going
sure,
to
sure.
be, or maybe the herb that they're using may be a reason. Then if it is, then we know it's the herb, and that herb, um, that herb.
Yeah,
And
that's
then
the
I love doing this because sometimes I learn like cool things from my patients, or not patients, but
so
members.
that's the
Members.
regular one, and the K1 is the like jet fuel. That's you're looking at the regular one, but the K1 from the same company, that's the NASA stuff. This is like, phew. And then
K1.
I did what I'm not supposed to do. I started 6 days on that before restarting LDN, and I'm thinking, well, that may help for side effects restarting LDN.
Amazon doesn't have it.
Yeah, probably
It
that.
doesn't have the K1. Where do you get it?
Google it and you'll see it. It's the same company, but yeah, I apologize for the other people there if they want to ask a question. I know that you're like you want to
It's
respect your
okay.
time and everybody.
We're all learning from you.
I mean, it's been 7 days, but at day three, I was like, "Whoa, what is this?"
Well,
And
I have had people who believe or who say that exogenous ketone is helpful. I
yeah.
just haven't found it, but I
So
do know
go
that is
K1.
true.
The no,
Uh,
you were the previous page K1 on top. You'll see it. K1
the
partner
supplement.
access.
Yeah, this is the supplement, so they should have everything here.
No, 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 no. You need to do
Go back.
K1
Go back.
access partner, and you'll see
Okay.
it.
Let's go back.
And I know it's even more expensive.
Oh, here we
K1
go.
partner. Yeah, that's it.
Oh, partner access. So I don't even know I can
So
access it.
that's the jet fuel from NASA.
All right. So I will close this and then I'll go to secondary. Uh,
So my LDN makes me crash in the afternoon, so I take the K1 at noon to try to help with the LDN side effects a bit. but I've also reduced my dose of LDN. So I went from 0.25 to 0.1. So that's my dose for now. So maybe if
It
it helps.
is BHB plus dihydroxypentanoic acid sodium. And then there's caffeinated and caffeine free. Do you drink the caffeinated or caffeine free?
I have the caffeine one for now.
Yeah.
Yeah.
I think it's a hype and it's total moneymaker.
Possibly.
What I'm saying is that it's not yeah, so there is no, it's either there's no studies, there's nothing known about it. Do me a favor, see what happens if you take the other one and then
Yeah.
Also take it with caffeine.
I have the other one. I tried it yesterday, but I'm just in the beginning, right? So
Yeah.
they
Yeah.
say like immediate effect for some symptoms is right away, but like full benefit a month, 3 months, just like LDN.
Yeah, but you know what? Thank you for teaching me something. I've not found exogenous ketones to be helpful, but what I was going to say is that, but if you're like using ketones to treat condition, if you're using ketones to treat anxiety, then I think exogenous ketones, there's a place for it. If you're trying to use ketones for suppressing seizure, then exogenous ketones may make sense. For people who want to lose weight, um, I don't know. I mean, if that helps with the hunger, then it'll do well. If not, it'll be a problem. But I don't think it's proven. I think that if it's exogenous ketone, I don't think it's with that. If I'm not telling you to do it this way, but if aliens kidnap me and say, Dr. Kim, you have to come up with a cheaper version of that thing, then I will say D-ribose plus creatinine plus ketone will be my answer.
I took the ribose and creatinine and nothing worked. Creatinine made me
With a ketone. With a ketone.
with the ketone. Okay.
Yeah.
Next time you tell me about the GLP-1 at microdose and what you think about that for fibro.
Sure. I'll come back and ask me, and we'll talk about that. Kiki, welcome. How are things in Vancouver?
Tiring today. I'm just my question today is if I have a method to improve or increase deep sleep,